Is there any progress to be made with those who are vaccine hesitant? Hi, I'm Dr. Abe, Associate Professor in Nursing at Western University, and here on What the Health, I want to make your healthcare questions clearer. So, as we move towards a more functional future in the context of COVID-19, we'll continue to see a combination of monitoring, vaccination, and public health protections. One of the things I've heard more and more recently is that there's just some people who are never going to change their minds. What I wanted to highlight in this video is that with the actual data on first dose rates of vaccination, there's actually a lot of hope to be had in this area. So by mid-August 2021, there was a noticeable slowing down in terms of the vaccination curve. At that time, we were around 80% of eligible Ontarians who'd been vaccinated, and Canada as a whole was actually ahead of much of the rest of the world in terms of that degree of uptake. And so I started to get concerned at that point that 80% was actually going to be our plateau, which to me felt pretty low because if we look at vaccine intention around other conditions, in Canada it usually runs more like 95% of people who would at least be interested in vaccination, even if they don't always end up getting it. So since August, though, the positive story here is that there was a little bit of dip as teenagers became eligible because they didn't get the vaccine quite as much as other age groups. But overall, it has been continually this slow and steady climb. And we did see some particular jumps around the vaccine passports and requirements to be vaccinated for travel, for work, and for recreation. And the fact that it hasn't stopped going up is something that I really think we can't forget and is a really important message. And at this point, here in Ontario, Canada, we are at 91.1% of the population who are over the age of 12 who've had one or more dose of the vaccine. So that means that only 8.9% of people have had no vaccine at all. So the really important message here, I think, is that far fewer people are actually solidly anti-vax, and far more are just vaccine hesitant than maybe it might appear or that some people might have predicted. Because, I mean, the early polls pre-vaccination was even worse. It showed only 60% of people had an immediate interest in getting vaccination, though those numbers changed really quickly once the vaccines actually came out and once they released the safety data showing how safe the vaccines were and how effective they were. So now that we've broken the 90% level in terms of vaccine uptake, I think it's really clear that those who are fundamentally anti-vaccination around COVID are actually just kind of disproportionately loud, and they're a very slim minority. They've got a lot of press, and they're vastly overrepresented, I think, in comment sections online, which probably has a significant degree of astroturfing involved in that. And, you know, they've definitely made themselves heard. And if you get 1,000 people to protest anything in Canada, it looks like a pretty big number, even if it's a tiny portion of the population. So really my message here, though, is not about anti-vaccines and the numbers involved. It's really this idea that essentialist statements around, oh, some people are just going to never get it, really actually miss out on the reality that there are many people who have avoided vaccinations so far who probably will still continue to get them sooner or later. As it's proven as we've crept up from that 80% to the 91% was that there were a lot of folks who were just late adopters on this thing. So I think it means that we need to continue to promote the science of vaccination. We shouldn't give up that idea that more people will still take it up. And we need to continue to have rules that encourage vaccination where we can and really keep on maximizing the protection of everyone.